So today we are operating on a very, very large intraspinal tumor. These tumors are rare actually, and this tumor is extending right from the level of T11 going up to L5S1 level. So if you can, focus here, I can show you. This is the upper limit of the tumor. Can you see this?
Yes.
And then this tumor is going up to here. This is the lower limit of the tumor. So this whole thing is a long tumor, and it is filling the spinal canal. It is compressing on the nerves which are going to his legs, and also supplying the private parts and important structures inside his pelvis. This young person came to us with history of difficulty in walking, along with urinary incontinence and weakness in both the lower limbs. He is just able to walk with slight support, or sometimes even without support, but with difficulty. This tumor was diagnosed about 5 years back actually, and after the diagnosis he was advised surgery elsewhere. But as we see very often in patients who come to our spinal tumor center, these patients who are diagnosed with spinal tumors, they are afraid of surgery. They are not told that unless they are operated in time, they will land up in a lot of problems. So they keep on trying Ayurvedic medicines or medicines of some other pathies, and a lot of time is wasted. During this time, the nerves get damaged, and some of these damaged nerves are damaged permanently, and it is very important to remember this. So when he started having urinary incontinence, difficulty in walking, that time he thought, no, he has to get operated. But had he got operated 5 years back, the picture would have been totally different. In today's world, these tumors can be relatively safely resected. In our spinal tumor center, we are especially interested in dealing with these problems. We get patients from all over India and indeed from all over the world. We use the best of the technology that is available, like the best neuromicroscope. We do neuro-monitoring at the time of tumor resection. This neuro-monitoring makes resection safe. That means if one is dealing with area of the tumor which is stuck to the nerve, then the neuro-monitoring immediately tells us that we are near the nerve, so the damage can be avoided. So such technological advances have made tumor resection, which were considered very difficult in the past, relatively safe. And again, perhaps you can focus here. This is a huge tumor, and we will have to very carefully separate the important nerves from the tumor cells, and then we plan to remove this completely. You can also see that because this tumor has remained in this cavity for a long time, it has remodeled the bone. You see this backside of the vertebra getting scalloped here, and the tumor has grown into the crevices between the vertebrae, like small projections. You see this? This is a very, very large, difficult tumor, but it can be relatively safely removed. The message that we want to give today to the unfortunate patients who might have such tumors is that please don't waste time after the diagnosis. Not all tumors are malignant or cancerous, and they can be removed if diagnosed early and operated early. The risks are also relatively less. So this is where you can actually see the neuro-monitoring waves. You see these patterns coming here, and she is the expert in neuro-monitoring. She has worked in neuro-monitoring for more than 15 years now, and she can pick up any nerve injury immediately so that we can avoid that. And it is one of the technologies which has made resection of the spinal tumors safer, right?
Yes.
It has made it very safe.
Yes.
Do you want to say a few words?
Yes. Today I will be doing motor evoke potentials of the lower limb, and I will be taking the pickup from the distal muscles, the tibialis anterior, the abductor hallucis, and I have also put electrodes in the anal sphincter muscles of the both the sides. If these routes are handled during the surgery, I will come to know over here.
Correct.
The baseline I have taken, as this patient is having problems since last 5 years, the amplitude of the waves is less from the beginning.
So you can already see that because he has waited
Yes.
for 5 years, and the surgery was delayed because of various reasons,
Yes.
because of the fear in their mind, etc. Some of the nerves are already damaged.
Yes, sir. Yes.
You are right?
Yes, sir.
So this also she can detect here.
Yes.
And while operating,
Yes.
if I go near the important area, you will tell me immediately.
Immediately, real time
So
I will.
there, real time you can
Yes.
tell. So there we can actually alter the method of our surgery and make this surgery very, very safe. Another thing that helps us immensely, as you can see this picture, this is the most modern neuromicroscope. It shows very minute structures clearly and with lot of illumination, making resections easy. So modern technology in last 5 years has changed the outlook of spinal tumors. At our spinal tumor center in Pune, we operate all these tumors with the help of neuro-monitoring as well as different technologies, which all of them I cannot enumerate here because it will take a lot of time. But modern neurosurgery theater is very important. And someone telling you that, yeah, there are risks, don't do it. The point here is that if you don't operate, then the risks are 100%. 100% that person is going to lose power in the lower limbs. So you have to compare that with doing surgery. Surgery may have 0.5% risk. That means 99.5% patients will get better and further things can be avoided. So it is very important to remember that.
Prevent the deficits.
Prevent the deficits post-operatively.
We can use intraoperative neuromonitoring.
So this is the video we wanted to make for the patients suffering from spinal tumors. Please don't be afraid of spinal tumors. They can be resected. If diagnosed in time, get them operated fast. One should operate them in the best centers where there is a lot of experience about spinal tumors, where there is technology like this, neuro-monitoring, which is very advanced technology, and get well soon. Thank you very much.
These are all.
What is that therapy?
That is the motor evoked potential, MEPs we call it. Initially, I am getting less over here. Continuous stimulation is causing a drop in the amplitude due to the fatigue of the muscles, as he is having weakness in the muscles. Yeah,
You want to do it intermittently?
Yes, so I will wait for some time and then again I'll stimulate. While doing the surgery, I will come to know over here if he is touching any root or any rootlet also rather. So I'll come to know over here and then I'll immediately tell him that he can change his style.